So we're going to look at the Metaverse. The presentation was called A Metaverse for a Unified Health Tech, aiming for physical and virtual integration of Qatar's health tech services. And speaking will be RK, President of Qatar Chapter for Government Blockchain Association. Please welcome him to the stage. Thank you.
Well, salam alaikum and good morning to everyone. Sorry, there was a little bit of a change in the overall schedule, so my session was the next. So let me start off with a little bit of an emphasis on AI. We have been discussing a lot on artificial intelligence, blockchain, emerging technologies, evolving technologies for the last 1.5 days, and you are going to see few more sessions based on artificial intelligence and the other technologies. What I thought was, from the overall ecosystem, let's take a part of AI ecosystem and then start explaining or share thoughts about what is called as Metaverse as a service and how does it bridge between the patients and the healthcare providers. So that's all that you will be seeing for the next few minutes. The agenda for the next few minutes, we are going to see some digital findings. We are also going to see some foreseen digital diseases which have been reported in the last 2-3 years since the COVID stage. And of course, when you have some findings, there should be some mitigation strategies also, right? So we are also going to see what are those mitigation strategies and how a simple look at Metaverse for the next 10 minutes can be covered, and how Metaverse is also a promising future, showing us a great display of environment or configuration which would take the healthcare providers to the next advanced level of service. We will also see how Metaverse as an innovation parameter is getting bigger and wider. Finally, we will have a look into the unified health tech platform, a Metaverse, and the benefits, and few current industry updates with an evidence that yes, Metaverse is also very fruitful, helpful, and it is also yielding the results which is expected. Finally, wanted to conclude, because there is a lot discussed from a technology perspective, I wanted to rephrase that Metaverse can also be called as either Mediverse or Healthverse or Midverse or Metaverse, whatever. The conclusion is left to the audience. So, as I said, have been reading a lot of research papers, white papers, and I've been seeing a lot of new technology-oriented disease which have been reported by various patients, and there had been occurrences of people reporting this to the clinical facilities. What are those? Some of them are digital eye strain, tech neck, a very different technology or term which is used, and smartphone addiction disorder. I'm sure everybody is aware of it. Cyberchondria and nomophobia, which is no mobile phobia. And what are these? Again, prolonged eye strain, irritation, and then poor posture, your way of working leading to neck pain and spine damage, excessive phone use affecting the mental health and relationship, and even the daily life for that matter. Hypochondria, excessive online health research. This is something what doctors are also reporting frequently now. There are a lot of patients who become doctors while they visit the doctors. They do a lot of research and they go and report and speak as if that they are the one who are going to write the prescription rather than the doctor itself. So this has become another major factor. Nomophobia, fear of being without a mobile device. I'm sure everybody would have seen a UK's Big Brother series which goes on always. They will be away from media, they will be away from any connected channels, they will be away from each and everything. So this fear of being without a mobile device is also being reported by most of the patients. And as I said, we will also see what is that projected digital disease, which I have been noticing through papers and reported articles, etc. Most importantly, we are talking a lot about artificial intelligence. The first one which I came across was AI, artificial intelligence anxiety. Second one was virtual reality psychosis. Next one was digital detox disorder. And then finally, cybersocial isolation, which I'm seeing even from my personal network and my friends and my families as well. Neurodigital degeneration. And what are these? As you know, everybody would be speaking about fear of AI replacing human jobs. This is what is called as AIAA. And virtual reality psychosis is the blurred lines between the actual and the virtual reality, leading to some kind of psychosis. Digital detox disorder, withdrawal symptoms of digital abstinence, where you are more used to digital platform, but finally, you're going to withdraw or you have already withdrawn. Next comes the most important factor, social isolation due to excessive online interaction. This is something which I'm personally experiencing, which means my friends, my family, they say, I was away from the social media channels, I was away from WhatsApp. That's the reason I couldn't contact you for the last, a week or 10 days. So this has become more right now. And due to this, there is also long-term cognitive decline from excessive digital stimulation. As we were discussing about findings and also projected, we need to see what are those mitigation strategies which we should practice or we should even implement in our daily life. One is balanced screen time and physical activity, digital literacy and education, responsible technology design. This is most important when AI is being discussed. Ethical technology design is very important when you're working on a healthcare facility. Ethical configurations, we can talk about generative AI, we can talk about consultative AI, image AI, but ethical technology design is very important. And when we talked about cyber isolation and digital degeneration, regular digital detox and your self-assessment is also needed. And finally, mindful online interactions. This is very important because, as you can see, there are still some more conditions which are coming out, and it is in the process of formally recognized in the medical literature. But clinical experts are clearly warning of their potential risk right now. So with that being said, let's have a quick look into the metaverse definition. Yes, it is one of the major buzzwords for the last, I would say, 2 to 5 years. But what is that? It is the major buzzword in the world of technology, healthcare, telecom, automobile sector, etc., etc. But what I wanted to emphasize is it is currently getting shaped either properly or improperly by the ambitions of the people who are using it. Because that is most important. A can be good, A can be bad, but depends on the people's ambition or the group's ambition who are trying to implement. And interesting aspect was, when did Metaverse came? It came, I think, almost about 2 to 3 decades back. It was coined by Neil Stephenson in his novel Snow Crash to describe a virtual world which is driven out of virtual reality. We have seen the definition, so everybody may want to understand what is that globally the trends are looking like for a metaverse. Yes, there is no unanimous percentage of everybody should go with AI, everybody shouldn't go with AI. There are passives, there are investigators, there are explorers as well, and there are consumers. Some explorers are really seriously exploring the goodness of the metaverse. Some investigators are still researching the aptness of the service. Passives, they are still unsure about whether to use or not to use. Consumers, industries like gaming, entertainment, telecom sector, they have all implemented metaverse, and it has been tremendously successful. This is the main reason, one of the agenda points when I said how the metaverse is giving a promising future. I would say we started off with normal phones, then we moved over to smartphones, and now metaverse is definitely going to be a biggest game changer and a major tech innovation which will drive our everyday's life, health, wellness, and also most of our well-being aspects since the age of smartphone. We are seeing metaverse getting used in rehabilitation services. We are seeing it in medical training. We are seeing it in multi-geography clinical experts discussions. We are also seeing medical surgery aspects and outpatient and inpatient services. This is, I would say, not the exact lookup of metaverse. This is a projected unified health tech platform where we are bringing in the physical and the virtual integration of health tech services into one metaverse platform. What does it give ultimately when you implement a metaverse service? It has an improved patient engagement, be it any service for that matter, medical procedure assistance, and metaverse-powered medical training and education. And from the technology perspective, blockchain for scoring and sharing the healthcare data, and some of the therapy and rehabilitation services, and most importantly for the biotech companies, augmented reality and virtual reality. That is another aspect which is being now produced as a platform from the biotech companies. Vision diagnostics and eye tracking, and then mental health and neurological treatments. Now, let's see the projected impacts. Metaverse has impacts on almost all the walks of our human life on a day-to-day basis, be it well-being, be it on the meta-medicine, be it on the meta-healthcare training aspects, the virtual wellness part of it, fitness, virtual relaxation aspect, medical procedures where multi-geography clinical experts come into picture and discuss about the patient's condition, meta-surgeries. These are all the projected impacts which is very, very, very clearly seen. As I said, there is no point in discussing without letting you know what are some of the industry insights. Yes, CVS Pharmacy has filed for NFT blockchain and Metaverse trademarks. Walmart Pharmacy drug program has become cheaper for many Medicare patients. I'm almost done with all my topic, but there will be a question at the end of the session, how a sustainable Metaverse platform, because it is new to the technological domain, it is new to the service which are to be offered, how does it look like? I start off with the point of addressing the sustainable developmental goal, which is good health and well-being. As I said right now, we are looking more from a patient-centric perspective. So when you see the Metaverse integrates both reality and the virtual reality part of it, there is patient equity and inclusion, which is to be given as the advantage of this implementation of Metaverse, predictive analytics for any platform for that matter. And virtual side, you have VR surgical training, voice of patients, digital twin implementation, et cetera, et cetera. On the physical side, pain management, mental health, et cetera, et cetera. This is a quick, I would say, healthcare or clinical care Metaverse mind map, which spans across multiple technologies, blockchain, digital twin, AI, interactive services, IoT services, each addressing some or various parts of the sustainable developmental goals. But a quick mind map is what is given here. This can expand and will expand in the very near future. Now, I come to the last few slides of the Metaverse presentation. The reason why I have put is, I will leave it to the audience or the patients or the clinical community. We started off all the way with, a manual prescription, manual surgery records, manual discharge records. We moved into a digital transformation through an EHR or an EMR platform. But the next advanced service which we can provide to the patient community will be through Metaverse, is the strong opinion of mine. It can bring in a lot of patient engagement, lot of service-oriented aspects, which we can produce through integration of AI and blockchain into the Metaverse platform. So I would leave it to the community to decide whether this innovation was bigger and the future innovation is going to be much bigger or wider. With that said, I wanted to wrap up the session with a few of a quick best thoughts which I read it in the internet. Patient-centered care is not just about having highly qualified clinical care teams, latest technologies, or the best equipment or advanced facilities. It is about treating the patients in the way patients want them to be treated. This precisely means respecting patient values, preferences, and needs. Second one being, healthcare is about trust. Learning to trust is a very difficult job, we understand. And the best way to find out if we can trust a system is to make sure you can trust others, and more importantly, they can trust you. The last and final closure note, revolution and evolution of Metaverse is not going to happen outside the system. It is very much going to happen within your system. With that being said, I conclude my presentation. These are my profile coordinates. In case if there are any questions off the stage, I'm happy to address those. Thank you.
Thank you so much. We have enough time. Thank you. Thank you so much for this. That was really great. We have a bit of time for a short Q&A. I see a question over there. Please give him the mic. Perfect. Thank you.
Hello. Hi, my name is Kanesk. I'm founder of Prognosis AI. We're working on EMRs. This talk in particular is of great interest because you talk about Metaverse, and mostly I would believe those VR headsets, right? My question to you is, like, as I talked to multiple doctors, and I tried myself when Google Glass first came out. So I was in Boston. I got lucky to test that. Like 10 minutes into using it, like I had a huge sort of like headache, and I talked to doctors too. So how do you foresee this thing getting evolving? And what doctors have given feedback to you of using those VR headsets for an extended period of time?
See, I will address it in various segments. From a patient side, they are looking into more of an engagement-oriented healthcare, which is very clearly seen these days. Although there is a complaint which I spoke a few minutes back, that patient, they have almost become advisors to the doctors, that they are also doctors. My point is, the first segment, patient itself is looking for these kind of a service. Example, rehabilitation services. Example, therapy services. Although I shouldn't say this, but still, technology kills technology. So we started off with normal computers using some softwares, and then we moved over into the digital transformation platform. But the fact of the matter is, patient, clinical community, healthcare providers, everybody is looking at these kind of service to be offered. So the engagement is becoming bigger.
I got your point, right? And it's pretty awesome idea. Like, I have seen a lot of different companies going into it. I guess my question is more like, with your interaction to doctors and like clinical people, like how are they open about using these VR headsets for a long period of time?
Point blank answer is doctors are very much welcoming on this.
Nice.
That's primarily because we are able to see a lot of multi-geography clinical expert discussions and documenting in your online system, which can right now happen only through MS Teams or any other collaboration platform or somewhere in your online platform. But these kind of metaverse platform, some doctors in US can read the nature and the case history and the other aspects of the patient right sitting in Qatar here. And you might have seen in the previous sessions as well, we have conducted robotic surgeries in the last 2-3 years in Qatar. So doctors are welcoming. There is only one side of, I would say, apprehension that patients are still not sure about it, because we are talking too many technologies to the patient. Artificial intelligence, blockchain. Come on, give me a break. Right. You can't go and inject everything in the first minute. It's very difficult for a patient to adopt it. So doctors are welcoming. I would say the patient side, we may have to take a step, because we have to prove and make them with an evidential proof that, yes, this technology will work and we are going to. So patient side is a reservation side.
Thank you.
Thank you.
Thank you so much. That was perfect. So this is the end of your talk. Thank you so much, RK.
Thank you.
And we're going to continue with the next session.